Dr. Rodman, and today we are going to talk about a very popular procedure that I perform, chin implants. Now, a chin implant, if it's done alone, can be done either under IV sedation or just under local anesthesia when the patient is awake in the office. Patients are generally sore and may need some low-dose pain medication, but generally, if we do it on, say, a Friday, patients are able to go back to work on Monday. There's two types of chin implants. One is the MedPore implant, one is a silastic implant. I personally prefer to use silastic implants. I think that they feel a little bit more natural, they're a little bit easier to work with, and the way that they're secured into place is just with a few sutures. And so just in the off event that something happens, the patient doesn't like it, they get an infection, it's very easy to remove a silastic implant in the office with just numbing medicine. The MedPore implant, the tissue actually grows into the implant, which is good for securing it, but it can make it very difficult to have it removed if the patient changes their mind or needs to have it removed for another reason down the road. The silastic implant is made from a hard rubber, has a little bit of give, which I think feels really nice and really natural under the soft tissue of the chin. It can be placed in two different ways. One is through an incision in the mouth. That's done for patients who prefer to not have an external incision. There is a little bit more recovery time with that because the intraoral wound is a bit larger and it tends to be sore for longer. Or it can be placed through an external incision. That's a little incision right under the chin. I place it in a crease right behind the fat pad of the chin. This generally heals really well and is nearly invisible at a year. So the implant sits right here on the chin. It generally gives projection in a horizontal plane. Certain types of implant may also give a little bit of vertical projection. I also like to use these extended implants because they fill in a little bit of this pre-jowl sulcus and help to prevent jowling in young patients before it develops.
There's all different shapes and sizes of implants. Here I'm showing you the two most popular types that I use. These are sort of the standard Conform implants. These are very popular in women because they add projection to the chin, but give a narrow shape to the chin and create more of a V shape with a little bit more volume. As you can see, they come in different sizes, and I use these sizers in surgery. Generally, I decide on the shape and size that I want with a patient, but I bring these sizers into the operating room, try them out, make sure that we're happy with the way it looks. Once we're happy with that, then I will open the permanent implant that goes into the patient. This is another very popular type of implant. These are the square implants, which are more popular with men. As you can see, this creates some horizontal as well as a little bit of vertical projection, but it gives a much more square and strong appearance to the chin. When patients come to see me and come for a consult with me, I try to spend time with them so that I understand what their goals and their needs are. There's many other types of implants, some that add more vertical projection, some that are more square. It's important that I have a conversation with the patient to make sure that we're on the same page and that the implant that we decide to place is exactly what they want.